So the question is, how do we detect a functional vision problem? So very often you might take your child to an ophthalmologist or an optometrist and they say, oh, the vision's fine. They might prescribe glasses for acuity, but they're really not looking at that functional vision. And as we know, at least 50% of children with cerebral palsy will have a functional vision impairment. Even upwards of 80% can have challenges with visual motor skills, with spatial skills, with even tracking or focusing. So really the questions are, you must ask the doctor, how do you test for a functional vision problem? Do you look at eye movements? Do you look at fixation, tracking, focusing skills? Do you look at binocular or depth perception? Will you do an assessment of visual motor integration? Do you look at visual processing skills? And if so, how do you treat them? Do you prescribe lenses and prisms in a therapeutic manner? Do you do any vision therapy, and or do you refer to somebody that does visual training of any type? So I would say you really need to do your research. I would also look at the organizations of optometrists that do this work, OEPF.org or COVD.org are a couple of organizations that will give you a practitioner search so you can find doctors that actually do this work. And of course, just go online, look on some of the Facebook groups. There's VTPU, which is an interesting acronym, but Vision Therapy Parents Unite. VTODs on Facebook is another group where you can see the optometrists that do this type of work and can actually provide functional vision care. And the other piece is ask your occupational therapists or physical therapists if they have done any vision training and or if they know of doctors that they typically work with that will work in these areas. So the question as to how does a parent identify if a child has difficulties? Well, some of the things that you can look at are, is there a reading or tracking problem? Do they skip lines or jump around? Do they report that things are sometimes clear, sometimes blurry? We call it behavioral optometry because you have to look at the behaviors. So oftentimes children don't complain because they don't realize that other people don't see the way they do. So you have to look at, are they getting close to things? Are they squinting or blinking? Do their eyes water? Do they avoid certain tasks? So if they're avoiding reading or if they're avoiding tasks that require fine motor and hand-eye coordination, there may actually be a vision problem beyond the motor difficulty. You can also look at what the eyes are doing. Do they tend to stare off, or are they engaged, and do they stay fixated on point? Can they maintain eye contact? Can they maintain interest in visual tasks? Do they need frequent cueing? Do they forget what they're doing? Do they have difficulty with multi-step directions? Do they have difficulty with spatial organization? Do they bump into things? Do they have poor coordination? Do they have difficulty on the playground? All of those things can indicate a potential vision problem. So if that is the case, it does make sense to search out and try to find a practitioner in your area that does identify functional vision problems and can treat them appropriately. Again, there's certain organizations that you can look to. COVD.org, OEPF.org are a couple of them. The Neuro-Optometric Rehabilitation Society, neurovision.org is another one. But I would just reach out to your communities and find out, are there any optometrists that do vision rehabilitation or vision therapy or prescribe prisms?